Hello, good afternoon, everyone, friends of Freeport Medical Center. All is live, right? We are very grateful to interact with our Freeport Medical Center friends, Facebook friends. I'd first like to say that I introduce myself properly to some of the people who don't know me. I am Dr. Das, the medical director of Freeport Medical Center, and our facility is located on 105 Freeport Mission Road, Freeport. It's approximately 3 buildings from the Freeport Police Station. We at Freeport Medical Center here are celebrating our 10th year anniversary in February of this year, and we are extremely elated to announce to the country and to all our patients of our extreme success over the past 10 years. We'd first like to thank everyone, first of all, for visiting our center, all our patients, all our customers, all our clients who have visited our center over the past 10 years and who have contributed to our extreme success. I'll also like to take this opportunity to thank the staff, the people who live in and around the Freeport environment and the central area who have patronized our institution. Without further ado, I would like to discuss 2 important topics which are, according to the World Health Organization, they are highlighting for this month, the month of January. That would be breast cancer and cervical cancer. So I will start off with breast cancer this evening, and we will see how far we can get with the breast cancer part of it. In terms of breast cancer, I would like to let everyone know that breast cancer is the most common cancer for women. In fact, breast cancer is the 4th most common cancer worldwide after respiratory, colorectal, and prostate. Breast cancer is the 4th worldwide and is the most common cancer in women. To let you know, I am a member of the American Academy of Family Physicians, and this academy, the American Academy, publishes world-renowned journals and information. So most of my information would be coming from this world-renowned American Academy of Family Physicians. So just to say a little statistics, in America, and we can use that information to postulate what happens in Trinidad because we don't have exact data, but in America the incidence of breast cancer is 120,000 per year. 120,000 patients per year develop breast cancer, and out of those 120,000 there will be at least or approximately 48,000 women will die from breast cancer every year in the US. Just to make the statistics a little bit simpler, we can say that breast cancer is most common amongst the ages of 50 to 74 years of age in women, although it can happen at a lower age and also at a higher age. It is most common at 50 to 74. It's a cancer that can be diagnosed early and can be prevented if necessarily tests are done. I would like to then go into some of the things that can be done to diagnose cancer at an early stage before it spreads out of the breast and goes to other organs, which then becomes very difficult and sometimes very fatal. The important thing to note is that from the age of 20, women should be taught, or they should know that they should start doing breast examinations, self-breast examinations, so that you become familiar with the contours and the structure of your breasts. And if there are any changes, for example, if you feel a lump, or if you feel a swelling, or if there's a tenderness in the area also, you should report it to a doctor immediately. I'm proud to say that we see quite a lot of female patients here, and we have diagnosed a lot of cancer, not only breast, but many other cancers, including prostate for men, early, and we have saved a lot of lives at Freeport Medical Center, where we have made the diagnosis. We have treated these patients and sent them to the relevant institutions where they can get appropriate management and treatment. At the age of about 30, all women should have a clinical examination. A clinical examination basically means that you should have a breast exam by your doctor. This is an important point because the doctor is familiar with the anatomy of the breast, and therefore if there is something abnormal, he will be able to pick up very easily and then make the recommendation for different tests. In terms of regular screening, however, at the age of 40, the American Academy recommends that all women should start having between 40 and 45 mammograms. They should start having mammograms. And these mammograms should be done every other year if they are negative. So you start having mammograms from, say, between 40 to 45, and you have it every other year. You continue to have these mammograms. If they continue to be negative for up to about the age of 50, 55, then you can space it out like every 2 years or 3 years. But in the beginning, you have to have your mammograms regularly. And of course, you will also have to have your breast examination by a doctor every year. This one is different from the mammograms every year. The mammograms are very important. I can't stress how important it is. And it is important for all of our friends on Facebook to know that mammograms are available at Freeport Medical Center, in addition to ultrasounds of the breast and CT scanning of the breast, which we do here as well. We also I'm the head doctor at Freeport Medical Center who will be conducting these exams, and these are available every day of the year, every single day. We even open on Saturdays and Sundays, and these can be done by appointments with the receptionist. Now, in terms of diagnosis of breast cancer, once or if a lump is discovered and a mammogram is done and it is suspicious of cancer, the diagnostic test that has to be done is known as a biopsy. And there are many different types of biopsy, but to say it simply here is where a ultrasound machine is used and a needle is stuck into the breast, and the ultrasound machine is going to guide the doctor to stick the lump exactly on the point where the lump is located in the breast, and the samples are taken, which are then sent to the laboratory to be tested for confirmation of cancer. So that's what we call a diagnostic test. It's also available at Freeport Medical Center, and we do have our specialist who is well trained to conduct this test, and these tests are also available by appointments. To go in a little bit further, because I know this is very important information, I would like to say that if a cancer is diagnosed, there are other tests that needs to be done, and that would include tests like ultrasound scanning, and CT scanning, because as the physician we would need to confirm or to find out if these cancers have spread outside of the breast tissue into the chest and sometimes into the abdomen and even other organs. So CT scanning is what is used, and this test is very accurate and very specific to tell for spread outside of the breast. Alright, in terms of breast cancer, and as I already said, it's one of the most common form of cancer worldwide, and it's the commonest form in women. It's just to say a little bit more, who are the people who would be at risk of developing this type of cancer? Well, the most important thing to know is that sometimes, in fact a lot of times, patients who have these problems do not have any signs or any symptoms on their breast. So therefore it comes back to the importance of seeing a doctor for the yearly annual examination and doing the mammograms. However, once you belong to a few categories, you have to be even more alert and more attentive in terms of doing screening tests. These would be all women over 45. So once you're over 45, you know that you're at risk of developing this. Because as I said before, sometimes these cancers show up without any signs, without any pain, without any discharge, without any lump that you can feel, as the case may be. Secondly, if you have had a family, a relative, especially if it's a first degree relative, including your mother or your sisters who have had cancer, you are definitely at a 50% higher risk than someone who did not ever had this type of family in this type of situation in their family. Also, if you have had a second degree relative, you are also at a higher risk. The other types of patients who have to be more careful would be patients who have had their menses at an early age, so that if you started to have your periods, menstrual cycles before the age of 12, and who have had their menopause at a later age. Say for example you have had your menopause over 50, over 55, then you know you're at a higher risk. Alright, patients who have had long-term use of contraceptives would also be at risk as well. So those are the most common cases of patients who would develop, who would be at a higher risk of breast cancer, and has to be more alert, more attentive in terms of screening and so on with the mammograms. All right. What about, how do you go about treating breast cancer once it's developed? Well, breast cancer is complicated. What I've said so far is an overview of the problem, but it's very complicated, and it has been said that it is best to diagnose this at a very early stage, which makes the treatment very easier than if it's diagnosed at a later stage. So in terms of a physician, what you have to do is what we call staging of a cancer. Staging of a cancer is simply to say if the cancer is within the breast or if it has spread outside of the breast. And once the cancer of the breast is localized within the breast, it makes it a little bit easier to treat than if it's spread outside of the breast. And there are many different forms of treatment, but the treatment is really surrounded by surgery. Surgery is the main method of treatment, in which you have to do a surgery to take off either the lump or the entire breast, which is known as a mastectomy, where you take off the entire breast, and of course you try to take off the glands under your armpits as well with the surgery. All right. Sometimes you also would choose to do radiotherapy, where a beam of radiation is directed to the cancer cells themselves, trying to burn these cells and trying to more or less kill these cancer cells so that they would not continue to grow. And of course chemotherapy if it has spread outside of the breast. Okay. Just to add one more important, very, very important point to people who are predisposed to cancer, and that would be recently there has been shown that sometimes their patients are classified according to their genetic makeup, and sometimes they have shown that there could be a gene that could predispose patients to developing breast cancer as well too. All right, but that is, of course will involve more elaborate tests which has to be done. All right. In terms of self-examination, what you look for when you examine your breasts, you look for a lump. You check your nipples to see if they are distorted. You can also check for discoloration on the breast. You can check for discharge, and very importantly, you can develop bloody discharge, blood discharging from the nipple, or sometimes pussy discharge, as the case may be. And also sometimes when it gets really bad, I've seen patients who have developed ulcers on the breast because the cancer has started to erode the breast tissues and make it and develop ulcers. So breast cancer, as I've said, it's very common, and I'm seeing quite a lot of our Facebook friends logging on. I like to say hello to Mika, Taina, Sunita, all these fans on Facebook who are logging on to us. I really appreciate you all listening in and taking in this very vital information. But it's important to really get screening early, be diagnosed early, and also to be treated in case there is an incident of breast cancer. All right. You all want to continue? Okay. All right. The other topic for discussion today, it would be cervical cancer. Now, in terms of Freeport Medical Center, we are really strategically located in central of Trinidad. It's in Freeport area. For people who knows Freeport, it's 3 buildings from the police station, and we provide all of these services, including blood tests, including biopsies, CT scanning, mammography, ultrasonography, X-rays. All of these tests are provided at Freeport Medical Center, where you can get your screening done, as well as also the treatment as well for breast cancer. I'd also like to touch on the other topic that the World Health Organization is highlighting this month, and it's cervical cancer. Again, there's another cancer that affects very high up on the list for women. It's the 4th most common cause of cancer in women. Again, breast is number 1, lungs 2nd, colorectal 3rd, and cervical is the 4th. According to the American Academy, 48,000 women would develop cervical cancer, and out of those 6,000 people would die from cervical cancer every year. All right. It's a common cancer. It means therefore that you have to be proactive, and you have to have the correct screening test done simply because, again, cervical cancer is one of those that can be cured and can be if it's detected early. And in fact, we do have screening tests for cervical cancer. Cervical cancer is where the cervix, now the anatomy of the reproductive system is, you have the uterus, which is known as the womb. You have the lower end of the uterus is known as the cervix. You have the fallopian tubes, and you have the ovaries. And that now is connected to the vagina. The cervix is where the cancer starts to develop. And in the cervix, you have something called the transformational zone. There's a little bit of medicine here, but it really means where the cells from the vagina goes up into the cervix, and there's a joining, a point where both cells join, and that is the point where the cervix cancer starts. So cervical cancer is, and I like to say hello to Sally as well. Sally, or one of our patients who comes from quite Valsain to see me. Hello, Sally. Nice to see you logging in. Yes. Now, cervical cancer. Back to cervical cancer. It's an area where the physician now would have to take the sample, send it to get it tested. This is what we call a screening test for cancer, known as a pap smear. Now, when you conduct a pap smear, you are taking the cells, the sample from that area. You send it to the laboratory, and is where they're going to be doing the examination of the sampling to test to see if the cells from that zone has changed and become cancerous. All right. It's again very common in women over 40. So therefore, pap smears should really start from, at around, it has been said that it should start from about the age of 35, but actually it is said that once you're sexually active, once a woman becomes sexually active, they should have their pap smears. So even, it's recommended for women to start having their pap smears at an early age now. The new thought is that you should have your pap smears from an early age once you're sexually active. And that brings me now to the point of what causes cervical cancer. Cervical cancer, a lot of research have gone into cervical cancer. It has been around for quite a while, and it has caused a lot of mortality in women over the years. And the research have shown now that cervical cancer is caused by an infection by the human papilloma virus, HPV virus. So therefore, HPV, which is a sexually transmitted disease, which can cause other things, but actually it is the cause of cervical cancer. And there are many different strains in viruses. Viruses mutate, so you have different strains, but the strain that is one that we focus a lot on is 23 and 18. But so this virus then attacks these cells, and it becomes cancerous. So therefore, because it's a sexually transmitted disease, then also once you're sexually active, that predisposes you to developing cervical cancer. So that's the other thing you have to know. So once you become sexually active, you are at risk of developing this cancer, as well as you're at risk of getting the infection, because this infection is sexually transmitted. Hence the reason why having the pap smears. Now, who, apart from sexually active women and women who have had infection with HPV, generally it's an infection that will affect generally people who have had a family history again can develop it, because there's although a 10% chance of persons developing this cancer who did not have this infection as well. So who have had a family history, people who smoke, those two other things with other characteristics would develop it as well too. I would also like to say hello to Colleen, who's also logging in as well too. Colleen, and Mohani Basde, who's also logging in. Yes, so the in terms of cervical, in terms of the symptoms, how do you know? How do you know as a woman, as a female? How do you have an idea? What would you say? How do you suspect that you might be, a patient with this problem? Well, believe it or not, just like breast cancer, about 50% of cases may not have symptoms at all. 50% of patients may not have symptoms. So the way to know this is to really do the screening test. Okay, but some patients may have symptoms, and these would include abnormal cycles, pain with your cycles. You may have bleeding, abnormal bleeding, and especially after intercourse, and you may have bleeding with intercourse. Alright, those are the symptoms. Then as it spreads, you can develop constipation, problem passing urine, frequent infections, urinary tract infections. Those are some of the symptoms that the doctor would look for to see if someone might be suspicious of this problem. Alright, of course, because we said that this cancer is it is caused by HPV virus, then there is a way of preventing it, and patients need to be aware that you can get vaccinated for the human papilloma virus, and this would prevent you from developing cervical cancer. This virus is available in Trinidad and is also available at our medical center here. But this vaccine is available here, and the vaccine comes in it's a 2-shot virus, so that you have to take one vaccine now, and then after 6 months you get the booster shot to prevent you. It is given for young girls before they become sexually active, probably at the age of 10 to 12, and then you repeat the vaccine after 6 months. So it's very good. It's an excellent vaccine, and I recommend it for all women to get the vaccines. To also mention here at this point that the pap smears are available at our center here, and the pap smear is conducted. I conduct all the pap smears, and it's available by appointment. It's best done at least a week after your period, a week to 10 days after the beginning of your period, and you'll get the best sample to be sent to the lab. All right. Once a pap smear becomes positive, then there are other tests that has to be done, like a colposcopy, ultrasonography, CT scanning of the pelvis to make an accurate diagnosis. And sometimes you have to do something what we call a curettage to send it to the lab again to test. All of these tests are available at Freeport Medical Center, where you can get your diagnosis and your treatment of cervical cancer as well too. So it's coming down to the end of my live feed on Facebook, and I really would like to thank all our friends on Facebook who have been logging on to us and who've been supporting us as well throughout our 10 years. And I'd like to remind everyone that this year, February, in fact next month, we are celebrating 10 years at Freeport Medical Center. We would like to really take this opportunity to give back something to our patients, our community, our country, and hence the reason why I am live today, to give information and to enlighten everyone about what we do at Freeport Medical Center, and to enlighten you about common diseases. And this will be a regular feature which will be done every week. Next week we will be sharing other information. This week we have chosen to talk about breast cancer and cervical cancer. And next week there will be other topics that will be discussed. If there are any questions that anyone may have, you all could also contact us on Facebook, and we would respond appropriately, pertaining to these two topics that we discussed today. Coming up soon, we will be having our 10-year anniversary in February, where we would be having a few free clinics, and that will be announced later on. I would like each one to stay tuned to be enlightened about our free clinics that we will be having for the month of February, and I will be very happy to dialogue and consult with people and patients during this clinic. I would like to ask and beg everyone to please try to be healthy, live healthy. Please get your tests, get all your examination, and to please try to stay healthy, get your screening tests done. Remember that your general health, like your blood test, cholesterol testing, diabetes testing, all of these are also available at Freeport Medical Center, and you can always come in and get an appointment to have all your tests done, including your pap smear and your mammogram, as I've mentioned before. I'd like to thank everyone for logging in, and thank you all very much, and I'll see you all next week. Thank you very much. Bye.